and we are really happy to be here with our medical team. Also, I'm very happy to welcome our Vice Chairperson, Mrs. Prita Reddy, and she has been our inspirational leader and global healthcare leader in helping the medical clinically advanced program in our hospital. And we have a group of surgeons who perform this surgery, led by Dr. Ajit Pai. Dr. Ajit Pai was trained in India and also in UK and USA. This particular patient came to him with a massive tumor with the chest wall compressing the heart, lung, kind of a critical tumor which needed multidisciplinary approach. So we have Dr. Rajarajan, vascular surgeon, and Dr. Ramesh, plastic surgeon, and of course Dr. Yusuf, thoracic surgeon. So multidisciplinary team involved in this surgery to remove this tumor. Now just as we came, we met the patient, and he is so happy to see that he has recovered completely and he is fit to run like that. He looks like very happy care he received in our hospital. So I welcome all of you for this wonderful press conference to announce that we have done this very rare procedure which helped these patients. As we know that Apollo has been leading healthcare of our country, and we continue to take care of other patients coming not only within India, even outside India. One such patient is Mohammed Abdullah, and welcome to our patient also who is with us, and thank you. Thank you very much.
My dear colleagues and fellow surgeons who have joined me in the pursuit of a perfect outcome for this patient. So thank you, Mr. Abdullah, for coming here and agreeing to share your story, which is so inspirational. So Mr. Abdullah presented to us in the month of February with an extremely complex situation. So he came from Bangladesh with a huge tumor in the chest wall. It was extending deep into the chest and into the neck. He was operated initially in December 2020 in Bangladesh, but unfortunately his tumor came back in a very aggressive form within 6 months. So it was growing rapidly, and he came to India because he knew that the infrastructure, and he was told this by his doctors, did not exist in Bangladesh in its present form. So he was evacuated in an outside center in India, and an extreme complex situation was determined. They used chemotherapy to shrink the tumor, but unfortunately chemotherapy really doesn't work in chondrosarcomas, and the tumor continued to grow. It had involved critical structures in the neck, including the windpipe, the footpipe, and the large vessels arising from the heart. So it had three major components when it came to us, as we could see. One into the chest, compressing the heart and brain vessels, one coming out through the chest wall, and the other part coming to the neck. He started developing extreme difficulty in breathing, swallowing, and chest pain. He was quite miserable when he came to us and very sick. Not the gentleman you see today who is absolutely normal. Many doctors in India had seen him at different institutes, but no one was willing to take him up because it was extremely challenging, and the probability of success, quote unquote, was supposed to be very low. At this time he came to us and we evaluated him. We used advanced imaging modalities, including a 640 slice CT to reconstruct the entire anatomy and the 3D reconstruction. The scans revealed a tumor in the chest wall and neck, and involvement of the sternum, which is the central bone of the chest, the collarbone, the ribs on both sides, the vessels in the chest and the neck, such as the aorta, carotid, and subclavian, and the windpipe, which is known as the trachea. So this is the gentleman with the pre-surgical appearance. You can see he's got a large scar. The scar is right there in the middle, the previous surgery, and there's a huge component in the neck, in the chest, and a large part of the tumor is within the chest, compressing the heart. So we studied it in detail, the scans with the radiologist and with the cardiothoracic, vascular, orthopedic, and plastic and reconstructive surgeons. So this is a team which we fortunately are fortunate to have in a place like Apollo, and we use routinely. We did a lot of preoperative planning to crystallize the steps of surgery. And this you can see the huge tumor in the scan. So this is a scan, this is the head and brain. You can see the tumor in the neck going into the chest, and that's the heart. So this is just one section showing how huge the tumor is, almost the size of a large football. We operated on 25th of February. The team included myself, with my colleagues Dr. Naveen and Dr. Bharat, the cardiothoracic surgeon Dr. Yusuf, vascular surgeon Dr. Rajarajan and Jason, orthopedic surgeon Dr. Arun Khanna, and plastic surgeon Shafaq Ramesh, ably supported by the cardiac anesthesiologist Dr. Bhaskar and team. It was truly what we call multidisciplinary, which can occur in a setup like this. It took about 14 hours to resect the tumor completely. It was removed en bloc, which means that we removed it as one piece, not as separate pieces. So this included part of the central bone known as the sternum, the ribs on both sides, and the collarbone along with the tumor. We were fortunately able to get away with very little injury to normal structures because all the blood vessels were free. But what is important, I think, is the preoperative planning, which allowed us to see that these vessels could be involved, and we had systems in place in case these vessels had to be removed. One remarkable thing was that the blood loss was just 300 ml during this 14-hour surgery. Typically, we expect in liters blood loss for such tumors, and the patient did not require even a single unit of blood during surgery, which is remarkable and tests to the skill of my colleagues and the cardiac anesthesia team. This is how he was during surgery. You can see that that's the scar and this neck, and this is how we plan. This is the central part, the chest bone and the neck incision. This is just to show you how expensive it is and how difficult these operations can be. This is a small video. The chest bone has been lifted. You can see the huge component going onto the heart. So that's the heart with the arch of the aorta and the great vessels going up. We did it with the cardiac surgeon, but fortunately we could not. So that's the arch of the aorta, the great vessels. A huge tumor. So compared to what is seen outside, this is actually the tip of the iceberg, and the large component was inside the chest, pressing the heart. But we were able to get it off with careful dissection. This is a picture after completion of surgery. You can see the entire central part of the chest has been removed. The great vessels going to the neck and the thyroid. So the neck and the chest have become one cavity. And that's the collarbone on both sides which has been cut. So it is quite horrendous, the kind of defect which is there after surgery. So this is a video just showing what has been done. So again you can see that that's the heart beating there with the right and left lung, and the great vessels going into the neck and the veins draining into the heart. This is the bottom of the chest bone, the sternum, and the ribs have been cut on both sides. Right up, and that's the collarbone on both sides and the thyroid. So the entire thing has been removed. You can see there's not a trace of tumor anywhere. And that's the specimen. You can see it is around 8 inches, a 6-inch ruler, so at least 9 inches long and about 6 inches wide. Huge specimen, removed as one block, as we like to remove tumors for cancer surgery. At this juncture, the plastic surgeon, orthopedic surgeon came, and they really did a phenomenal job. So this is what is called bone cement, which is used in fractures and to fill cavities. It sets like hard bone, and then they reconstructed the entire thing beautifully and put a mesh also, like what is used for hernia, to protect the deep structures and encase it. At the end of the surgery, we were able to get a perfect outcome like this, where everything is closed, the tumor is removed, and we have done some plastic surgery with some tissue from the back. And this is the gentleman just 2 days back, and he's right in front of you. So it's a miracle, to see somebody who comes in distress, pain, has been told at multiple places that surgery can't be done, and we are able to do it in such a flawless manner to get the best outcome for the patient. And I would really thank both the patient who comes to us, trusting us with his life, and Apollo Hospitals and Vice Chairman and Vice Chairperson who give us such wonderful infrastructure and support. Incidentally, he also received a lot of financial support from the hospital, which was really a moral booster for him, because these are very complex and long surgeries requiring a lot of effort from the hospital and in terms of resources as well. Thanks to God and everyone involved for such a wonderful outcome for the patient. Thank you.
At the team, at the whole Apollo Hospitals group, because I think it's the trust of patients who we've healed over the years that has really made us what we are today. And for all the patients and their families who come to us, a big thank you and namaste. The members of the press, you've always supported us in our journey. It's almost 40 years in September. And at every instance, the press has been so supportive of anything which we do, not only, especially in the city of Chennai, but throughout India. I think, we come back with very data-driven, knowledge knowledge-driven outcomes. It's the kind of work which our doctors do, it's their expertise. And only then do we say that we really want to talk about it, because others should know that India can do such amazing work, and I think that's the reason why we're all here. Of late, you would have heard from the Honorable Prime Minister's, and how he is so proud of the clinical teams in India, that Heal in India, which actually Apollo started, has now become a national mantra. It's a national directive, an executive directive saying that we should do whatever we can to see that not only we are able to heal for our Indians within our country, but for the rest of the world. And that's why we see like a steady stream of people from overseas coming to India, because our outcomes are on par with any center in the world. And I think today's surgery, which they're talking about, is really proof and testament of the fact that we can do anything in any area, whether it's high quality surgical work, or whether it's our cancer work, our cardiac work, even our genomic related work. I think India has become on par with the developed nations, and for that we have to be so thankful. Having said that, I had the opportunity to interact with some global audience, and they said the way we have handled COVID as a country has been phenomenal, and it's going to be a global case study. And for that, I think we have to be so proud of ourselves. I don't think anywhere in the world for vaccines to have been, usually it takes 4 to 5 years. Here it was done in 4 to 5 months. That's the kind of caliber Indians have, and we have to be extremely proud of the fact that we can do it. So having said that, this is such a rare case. It was a 14-hour operation. It was something which had been refused in multiple centers. It's not as if it was just taken up and it was so simple. It was highly complex, highly complicated, and to be able to have the courage to do it, I think it takes nerves of steel, which our clinicians seem to have, and a deep commitment towards patients and high quality clinical work. And I'd really like to thank them for that, because that is really the backbone, the strength of what Apollo is. Our chairman will always say, you can build a beautiful building, you can buy the best technology, and the banks and the private equity will come and fund it. But it's the people who make a difference. It's our high-class clinical teams, it's our nurses, it's our support team who really make a difference in what we do. And I think for that, I must congratulate the team. Dr. Ajit Pai, who was the team leader, Dr. Rajarajan Venkatesan, Dr. Yusuf, he couldn't come today, I understand, because again, he's got another complex case going on in the theatre. Dr. Arun Kannan, another very good surgeon of ours, Dr. Ramesh, Dr. Bhaskar, all of them and their support teams have done a phenomenal job. So thank you all for doing that and for constantly raising the bar in what we do. I truly believe that life is priceless, and to do that, we have to be completely committed to what we do. In every sphere of our activity, we have to work hard, we have to save lives, and the patients' families have to be looked after. So I think this is the DNA of Apollo, and the teams do it very well. So thank you and congratulations, and Mr. and Mrs. Abdullah. We're so grateful that everything is well, and Godspeed, safe journey back home, and the Apollo family will always be there with you. Thank you and namaste.
That we stand in front of you. I must thank Dr. Ajit Pai for treating this patient and also involving the whole team of members to give life to the Mr. Abdullah. So, as he rightly pointed out, I just want to add a few points here. See, it's a very complex tumor, as everyone said, that the site which is previously operated, any surgery which is fresh means it will be different. And when it comes recurrent within 6 months, that means the tumor is very fast growing. So it will the surgery is the only option for this tumor, because chemo is in the heart. So how will you be able to remove the tumor? So, and also it is involving the blood vessels also, that is coming and very close to the blood vessel. See, as he said, so this is a very congested area where the neck, the blood vessel is coming and also going to the brain, coming from the hand, both hand, and also going to the heart. Very complex area, and a lot of nerves coming. If you damage the vessel, respiratory system, and also there are a lot of structures coming there which can cause complications. So the most important here was we planned in such a way that involving the radiologist, how much of the blood vessel or the heart is involved or the adjacent structures from the chest wall. So he planned in such a way that the whole tumor has to be removed without any tumor left behind. That is the plan. So involving the heart surgeon, vascular, plastic surgeon, after reviewing how to close it up, that is also important. So we planned nearly about a week we have the facility of the image also. So I can put it in Tamil also, like when the tumor irukna adu sutti irukra tumor full ah and the tumor tumor illama irukkum kannu paatha tumor irukku andha mari edukka cure கிடைக்கும். So surgery ஒரே ஆப்ஷன் இருக்கிறதுனால so we have to remove the tumor along with the blood vessels also. Also heart ஏதாச்சும் ஒட்டிருந்தா அதையும் ஹார்ட் கொஞ்சம் டெம்பரரியா அரெஸ்ட் பண்ணிட்டு அதுவும் பிளான் பண்ணி வச்சிருந்தோம். So let's fortunately அது தேவைப்படல, ஹார்ட்ல கொஞ்சம் செப்பரேட் பண்ற மாதிரி ஆச்சு. ஸோ ஒரு பிளட் வெசல் மூளைக்கு போகிற பிளட் வெசல் கட்டாக இன்ஜூரி ஆகிட்டா கூட ஸ்ட்ரோக் வந்துடும். அந்த மாதிரி ஒரு ரிஸ்கி ஏரியா. இதில் பேரலிசிஸ் இந்த மெயின் சுவாசத்துக்கு மெயின் டயஃப்ரம் சொல்லுவாங்க, அந்த நர்வ் கட் ஆச்சுன்னா கூட ரெஸ்பிரேட்டரி பேரலிசிஸ் வந்துடும். எல்லாமே காம்ப்ளிகேஷன்ஸ் அதிகமாகும். ஸோ மெட்டிகுலஸ்லி வி ரிமூவ் தி டியூமர். பிளட் வெசலும் ஒரு கெட்ட ரத்த கூட எடுத்தாச்சு. லக்கிலி இந்த நல்ல ரத்த கூடலாம் ரிசர்வ் பண்ணுற மாதிரி ஹார்ட்ல இருந்து ஸ்ட்ரக்சர் செப்பரேட்டாக எடுத்து டியூமரை வெளியே பண்ணிட்டு அப்புறம் பிளாஸ்டிக் சர்ஜன் he will explain, Dr. Ramesh will explain how after remove the tumor, how it was reconstructed well. Thank you.
Surgeon from Apollo Hospital. This patient basically it is a rare condition. When a surgery is a rare situation, it is more difficult and more complex, and it involves extensive planning. And with the infrastructure what we had and the team which we have built, it was helpful in planning the process. It is the surgery resection part is done by the specialist, then the reconstruction part comes to me. So with the days of discussion before the surgery, the plan is charted out. There is no surprise on the table because the planning has to be so perfect. All the contingency plans, all the options, everything will be looked into when we start the surgery. That is how I come into the scene after the tumor has been removed. இப்போ பார்த்தீங்கன்னா செஸ்ட்டில் அப்புறம் செஸ்ட்டில் இதுதான் கேப். செஸ்ட்டில் the whole chest wall is removed, the part, major part of it, clavicles, the shoulder part, everything is removed. The chest wall, robust, strong, and should also move with the breathing. For that, I had to plan in a double layer mesh repair where you can see a mesh there. There is the mesh. We have put it on the chest wall. Upon the bone hard, which is used for bone fractures, and on that we wrap this mesh again. Following that, we need to cover with the muscles. The muscles are brought from the other parts of the chest, from this part of the chest and from the back of the patient, and we bring in the muscles so that new blood flow starts off, it gets complete. And even to look at the patient chest will look exactly like what it was before surgery, in spite of the tumor and the normal tissue, the chest wall has been removed. Still the patient will look normal and have the contour of the body because we have built it as is by this condition. The muscles are brought in from the back. You can see Even the skin is brought from the back of his chest to the front. Thank you.